We're still talking.
Who had to drive less than 10 minutes? No, less than 15 minutes to get here. And who had to go 30 minutes, 45 minutes?
Oh,
But you can, and you love you. Just so that you know, people have been asking what happened with the VFW myself. And I got a phone call from the commander at the VFW, and she said it came from higher up that they could no longer do any groups that were political. And I said, we're not political, we're bipartisan. And she went, okay, fine. What is interesting though, and maybe it was my assumption, when she said it came from higher up, I was thinking of outside of Monticello's VFW. But since it looks like we're gonna be at Buffalo's VFW next month, I guess that will be true. So Buffalo, it's more central, it should be good. Yeah, so, hopefully, the only problem with that is we had to change our day and our week. And I'll put it on the blast and I'll send you a million reminders and you're just gonna go, oh, tired of it. It will be, I believe, on Wednesdays, on the first Wednesday of the month, same time. But, oh, I said.
Show of hands. Show of hands. Who could make
How many
it?
people will that work for? How many people will the first Wednesday of the month work? First Wednesday of the month. Okay. Yeah, it is.
Yep.
It is a church night. Well, it depends on how involved and where you're involved in. But anyway, there you go. So that's number one. Tonight we're gonna start out. Okay, what's the correct title for today?
Indigenous Peoples Day.
Thank you very much. I did notice a few signs that said Columbus Day, but I think they're wrong and we just have to let them know. So to start out this evening, Lori is going to do our land acknowledgement.
All right.
Eat the mice.
Eat the mic. Okay, I was at the day McCoska this morning, earlier than I ever get. Okay. But I was there and it was beautiful and I'm glad they showed some of it on TV tonight because it truly was a beautiful morning with my native relatives. I'm on the board for the Division of Any Work, so it was especially heartwarming to share this morning with Indigenous folks. So now I have to put on glasses, so I can't see a thing. And I have to eat the mic besides. Okay, so I am going to do, oh, I have a lot of things to share. Yes, no, Sunday, yeah, or whatever it is. I was at the wedding of my niece, who we helped raise, who married her partner Hillary. And it was a beautiful, beautiful ceremony. So just wanted to share that. She's my heart. So yeah, her new life is unbelievable. And two former nuns married them. They fell in love. They got kicked out of the Catholic Church, but they retained their rights and they married them. So it was a whole day of huge celebration for all of us. All right, so now I'll get down to what I'm supposed to be doing here. This is the land acknowledgement. Oh, I also want to tell you one other thing. This morning, people were on the radio when they were talking about Columbus Day, blah, blah, blah. I think it was on CCL. And I called, and for any of you that listened, I was like, this is not Columbus Day. Do you know who Columbus was? He was a murderer and blah, blah, blah. You should have Adolf Hitler Day if you're going to support Columbus. And then anyway, I went from there. So I'm gonna just do the land acknowledgement before I get too carried away here.
Listen to WCCO, it's not a good thing.
Yeah, exactly. We recognize the enduring relationship between many indigenous peoples and their traditional homelands. We are grateful for the territory upon which we gather today. We respect Minnesota's indigenous people, the original stewards of its land, and we value the sovereign relationships that exist between tribal governments, state governments, and federal governments. Today, roughly 60,000 Native Americans live in Minnesota. We are committed to serve Native communities throughout Minnesota in partnership with our urban Indian communities through research, education, advocacy, and community outreach activities. We recognize both the state of Minnesota and the United States government carried out genocide, ethnic cleansing, and forced removal against the Dakota to acquire land. Yet despite centuries of colonial theft and violence, this is still and always will be Indigenous land. Indigenous people are still here. They are demonstrating innumerable talents and gifts in the midst of continued oppression and colonialism. We honor and celebrate Indigenous people. Thank you.
All right.
Hi, everybody. I'm Chris Brazelton, and I wanted to follow up on that with a trauma acknowledgement. We acknowledge that the United States emerged out of great historical, spiritual, and personal trauma for Indigenous and minoritized communities in the United States, and welcomed people from around the world immigrating from often traumatic situations. We hold this moment to remember the generations of people from all over the world who have migrated to the United States by force or by choice. We recognize and continually support the need for community-specific reparations or healing processes needed for healing to take place for violation of systematic policies against people. By offering this acknowledgement of trauma, we affirm the right of people to bring their whole selves to this place. Thank you. Okay. The other thing I want to remind you about, if you have any chance to forget it with the number of emails I have sent you, Saturday is No King's Day. We have both bridges in Monticello, Allen and Fenning, and you can do which one you want to. We had a bus to go to Minneapolis, and then they canceled it because they found out that the park that they were going to was private. So now they're putting together another one, and we have a bus, providing we can get enough people. The bus will board at 11:45 because our rally goes from 10:30 till noon. At 11:45, the bus will be boarded. It'll pull up in the Target parking lot towards the back. So if you need to run in the bathroom or get some snacks or water, you can real quick. The bus will leave around noon. It'll travel down to Minneapolis. I'm totally just the name of the park. But talking to the Commons, thank you. Talking to the person today, she believes that the buses will be able to drop you off and park. There's a short rally. There's a walk. She didn't know how long it was. So I don't know. Somebody there should know, and if I find out information, I will let you know. Then it will come back and it will bring you back to Monticello. The bus will pick you up where they dropped you off. The thing she didn't know is the timing. Because they said, well, will they be there for an hour or 2 hours? And she goes, oh, I'll get back to you. So I'll get back to you. But if you want to sign up for the bus or you want all the information about our No Kings, there's these sheets in the back. Or take a bunch and, just lay them around in a library or in a store or whatever, or give them to your family and friends and neighbors. Okay, with that, Rose? I don't think he quite made it here yet. We were hoping to have Louis McNutt here tonight. We'll see.
There's a detour on 8, maybe you got like.
Maybe you got one.
Can I ask you a question before you spoke here? You know for certain that people can park at Target for the duration that you're gone into the city?
I have to double check on that one. Okay. The parking lot at St. Henry's was fine, except if we come back too late, then that interrupts with their service.
Okay.
In the evening. So I'm still waiting to hear back on that. So I will let you know. Hello.
Good evening. Hi, how are you doing? So I'm just gonna tell you a little bit about our process in terms of endorsing Louis McNutt for Senate District 29 Senate race. And we sent out candidate surveys to both Louis McNutt and his vile, despicable opponent. You know which one we endorsed, right? Anyway, and then, of course, the Republican opponent failed to respond. Louis McNutt sent in a very detailed response about his positions and his values about 14 different issues. And so then we decided to endorse him. And what we're doing with that is we developed a flyer that includes what Louis McNutt stands for. And on the flip side, if we have, yeah, you want to hand that out? Yeah. Okay. On the flip side, it compares, Michael Holmgren, what is his name?
Holmgren.
Holmstrom Junior, forget that name, right? Anyway, it compares him with his position. And let me just tell you, if for no other reason, you come out and support Louis McNutt, it's because his opponent is extreme MAGA. In fact, thanks to somebody doing some super sleuthing, he actually owns what we think is a couple slumlord places in Morrison County. He's got a liquor store, he's got a laundromat and a couple of rentals, both of which have taken him to court for failure to make repairs. So he's about guns for everybody, whenever you want them, no registration, no waiting period, no nothing. Of course, no reproductive health care for women, no choice. He wants to get rid of the evils of abortion. And you know, just those are these, I think he's got 3 issues on his website, which is where we got some of the stuff in order to compare against. But at any rate, based on that, we endorsed Louis McNutt. He was going to join us tonight, but he's really, really booked. I don't know if he's going to make it. But we're going to do a day of action where we're going to go around in Monticello with that particular flyer. And we're going to go door to door and we're going to tell people why they should be voting for Louis McNutt and why we are. And this was a strategy that was done in Tacoma and it was very effective because generally I hate door knocking more than anything. But I went with my friend out in Washington, and when she went to the door with something that says, here's how to compare them, here's what they stand for, here's what you should look at, they were all over it. And of course, they've done more. Next summer, we'll be putting out other sorts of a whole candidate list, from school board to judges to county commission to city council, all the way up. And here's who you should be voting for if you support our values. So that's coming, but this is kind of our test run. So if you see on there that there's 2 days, the 26th,
25 and 26.
25 and 26, we'll be door knocking. And then afterwards, we'll have a little party. You know, we'll go somewhere and party maybe, if anybody feels like it. Yes.
Party's the night before, and here's the flyer for it. That you want to talk about. Colson and I,
Colton Cracky and I have hosted a meet and greet for Louis McNutt. There's flyers in my hand that we can pass around and they're on the back table. Please come if you are someone who can vote for Louis and get to know him. We have the upstairs of the Nordic Tap House from 5 to kind of whenever on October 24th. So it's the night to get you started for the door knocking the next day.
I also have, if you live closer to Delano, I have a meet and greet. Sorry, that's okay. I have a meet and greet at my home in Delano on Sunday, this coming Sunday from 4 until 6. So if that's more convenient to you, I can give you my address. I live at 1154 Willowbrook Circle in Delano. So
Okay.
you're welcome to come there as well.
All right, and one last thing on Louis McNutt, and hopefully it comes in and you can shake your hand and, you know, that kind of thing. Kind of a limp handshake, so if you can help them out with that. Three other things here. It's true, it's true.
It is.
It's true, I mean, no, it's vouches for me. I've got 3 letters to the editor about Lewis. And what I'm looking for is people from particular areas to submit them, 3 in each paper. And so I'm looking for 3 different people from each of these papers to submit a letter to the editor. And I just want to read you one of them, okay? And this is a quick one. Okay. Look at this. Okay. I'll just pick on highlights. Just District 29, vote for people, not party politics. And this is true. The November 4th special election for Senate District 29 isn't just another local race. It will flip a Senate seat and determine whether Minnesotans retain control over our own future or surrender it to Washington overreach and partisanship. We need to ask ourselves, do we want a senator who represents us or one who is beholden to party leadership and outside interests? Lewis McNutt is accountable to District 29 families, not political machines. As a working mechanic and union member for a decade, he understands what happens when Washington makes decisions that ignore local realities. For example, federal SNAP cuts don't just appear as statistics. They devastate our farmers, small businesses, truckers, and manufacturers, in addition to people who need the food. They hurt our neighbors. Lewis will fight against these destructive federal actions that undermine our rural communities. This election has statewide importance because it's about more than partisan scorecards. It's about whether we elect someone who will stand up for working families' real needs, affordable health care and housing, good paying jobs, properly funded schools, and an economy that works for everyone, not just corporate interests and political donors. I'm almost done. Lewis represents moderate, common cause values that transcend party lines. He's transparent about where he stands and accountable to voters, not Washington lobbyists or extremist factions trying to impose their agenda on Minnesota. We face a clear choice: elect someone who will fight for District 29 families and protect us from federal overreach, or elect someone who will fall in line with your party politics as usual. Okay, so, and this is, I think it states it all, and like I say, I think, is there anybody in the room who likes door knock? Anybody? Oh, my Chuck likes to door knock. I didn't know that about you, honey.
I love it. I love it.
Not knocking on.
Yeah.
Anyway, okay, so, do come out. It's only 2-hour stints. You can go slow. You can bring your walker, your combination cane and chair. I just got one in the mail today. So.
What time are you doing?
There's one on, the one on Saturday is at 10 a.m. and then there's one at 1 a.m. There's 2 flights going on.
It's not on.
No, it's not on there. When you register, you'll get an email back that gives you the details. So, but you don't have to register through this Mobilize if you like. I think we've got a sign-up sheet. We'll have one shortly. That you can sign up and say you want information about it. We'll email it to you. Okay, so yeah, please come. You know, it's really is important. We want to get the legislature back. It's our guardrail. It's our hedge against what's going on in Washington, D.C. Okay, so I'm going to send around this little sign-up sheet, and it has the names of some of the papers, and it also has 3 slots for submitting letter 1, letter 2, or letter 3, and then I will email you the version that is whichever one you selected, and then you can adapt it to your own, your own words or something. But If you do send it in and you sign it, because it's going into multiple papers, you should put behind it that you're with Wright County Indivisible.
Okay.
Yeah, Kathy.
Someone else last week gave me a door knocking permit, not at Elephant Park in Monticello, 10:25 at 12:30, is that?
10:25,
Yeah, at 12:30.
that's the day before, right?
No, that's the day of.
There's 2 days, that's 25th and the 26th,
Oh,
Saturday and Sunday.
25th, and that's at what time?
Well, I was told 12:30, I got that from SB 29. You know,
Okay, well, don't worry about it, we'll get you the information, but I could be wrong, I thought it was, we have a call with him tomorrow, so
Okay.
maybe we'll clear it up.
Okay.
All right, but if you wanna get the up-to-date stuff and reminders and stuff, you can sign up through Mobilize, which should be on the Facebook pages too coming up, right? Places for the link up. Okay, so I think that's it. Oh, one last thing, who was at the benefit? The concert. Okay, yeah, so. Yeah. That was a lot of fun. Anyway, the good news is that we made about $3,000. Took home $3,000 after paying expenses, and we had to give a bunch of money to Pioneer Place. Americans for Democracy got about $1,500. We took in about a total of $6,000 because we had to give some. But it was beyond money. Even if we hadn't made anything, I think it really nourished people's souls. It was a really nice event. So, okay, I'll send these around, and if you want to sign up to put one of these letters in the editor in, then don't take the letter, but put your email down, and I'll email you the email version.
Just to clarify a couple things. Yes, Wright County Indivisible is partisan. Yes, we can back candidates as long as we don't contribute financially. I have that right, Treasurer? So if people say, well, I thought you couldn't, yes, we can. You just can't give any money to the campaign through Wright County Indivisible. You personally can do what you want. Anyway, what are you doing? My turn. Oh, and also when Rose was talking about, putting Wright County Indivisible under your name, the last time we put a letter in various papers, someone in the Monticello area, wrote a letter the next week, kind of blasting how come this was a form letter, it was so very similar letters and blah, 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 blah. And, our editor said, okay, we can't have this. So if you are putting out a letter that you know might appear in other papers, please put Wright County Indivisible underneath there. If you're not comfortable doing that, then I suggest you don't do the letter.
Well, don't some of the
Write your own.
papers, don't some of the papers ask if you put it in other newspapers and they really don't like that?
You know, that I haven't run into with Monticello.
Oh, and I think a lot of papers would make you sign a physical name, not. Yeah. No, you have to put your name.
Yeah, you always have to put your name in. In Monticello, you have to put your city. You have to say Monticello.
So it would be like my name and then Wright County Indivisible.
That should be fine.
Okay,
Mhm.
perfect.
Okay, now to the good part of the evening. We have tonight Steve Larson. Steve's been a great member of Wright County Indivisible for I don't know how many years. He's been very good at pulling up information for people, disseminating information, letting us know what to write, letting us know if there's a rally. He's very dear member of our group, and with that, he's here. We are also, just so you know, recording this, and we will be sending it out on the blast, and we should be able to get it out on our webpage also. So if you know somebody who couldn't be here tonight because it was too far to travel, or for whatever reason, tell them that, we can get a hold of this.
How do you do video on the blast?
I'm gonna find out. I'm calling Julie tomorrow.
It's just a link.
It's a link, but I haven't figured out how to do it. However, I'd like to give you some of Steve's. Okay. So Steve is a former director of disability services for the state of Minnesota. During his 45-year career, he worked with people with disabilities. He was also a residential provider, county supervisor, and lobbyist. He developed an expertise in Medicaid because of his primary provider for funding for disability services. And as we know, it's on the chopping block. So let's give a big round of applause to Steve.
Thank you. Now, many people ask, Stevo, how can you be so good looking? I tell them, well, I had a stroke 4 years ago, and then a year ago, I fell and broke my humerus, and right humerus. And since then, I've had 5 surgeries to fix that. One was a week ago at the Mayo Clinic, because it needed some specialized stuff. So that's why I'm so good looking. And I also have an official diagnosis of being a klutz from the doctor. I've had, I think, 18 incidents in my life where I've broken bones, and some of those were multiple bones. And that doesn't even include a car wreck or anything. It's just skiing, Boy Scout camp, whatever, you didn't name it. Walking, walking, whatever. So that's why I'm so good looking, and I'm glad to be here tonight. Welcome to Wright County Indivisible's news conference on Medicaid cuts and how they will impact Minnesota and Wright County citizens. I'd like to welcome everyone to the Red Lodge Grill, where we're live. And we have also people listening on Zoom, as well as some national people listening in on. And so we're going to get going here. We have several speakers. So we already heard about me, so we're not going to talk anymore about that. This evening, we are fortunate to have some state and national leaders that will be participating in this news conference. I will introduce them to you shortly. Medicaid, known as medical assistance in Minnesota, but I'm just going to refer to Medicaid, is a major payer of healthcare programs for low-income Minnesotans, persons with disabilities, and the elderly. Think nursing homes. The federal government and the state of Minnesota each provide 50 cents on every dollar for Medicaid. So if we want Medicaid dollars, we have to allocate a similar amount from the state budget in order to get those Medicaid dollars. Impacts on Medicaid by the big ugly bill will be significant and greatly felt by Minnesotans. Preliminary analysis by the Minnesota Department of Human Services, based on the Congressional Budget Office data, projects that the federal law will eventually result in the loss of coverage for as many as 140,000 Minnesotans. There will be a test after this. The bill specifically targets low-income adults without children, saddling them with additional paperwork, forcing more frequent administrative hoops, and imposing Medicaid bills. Medicaid contributes significantly to the state's healthcare sector, supporting public health, infrastructure, hospitals, mental health services, home care, community clinics, nursing homes, physicians, dentists, and other health professionals. It serves as a lifeline for greater Minnesota providers by significantly reducing the number of uninsured. Minnesota medical assistance decreases the cost of uncompensated care that can threaten a clinic or a hospital, sustainability, and reduces the amount of medical debt owed by Minnesota. Medicaid covers 3 out of 10 births in Minnesota. Medicaid also insures 592,000 children, which is 41% of the state kids.
Wow.
Medicaid also insures 592,000 children, which is 41% of the state kids. So now we know who's going to get hurt if we have Medicaid cuts. After our speakers, I will share some Wright County specific information about citizens that are on Medicaid. And so my phone's ringing. I'm going to take a call here. Hi, Joe. What did you say? Oh, good. Thanks for sending that. It's on email? Okay. My son, who's in hospital administration in a rural hospital in Colorado, I asked him how Medicaid is going to impact his facility. So he just wrote me a brief statement, and I'll read that. Anybody got an extra hand or two? No, I'm fine. I just get. He writes, the big beautiful bill phases in through 2028. So impacts are slow coming in so far. Strategic planning in healthcare is challenging with inconsistency coming from Washington. We are concerned about how the current shutdown could be used to further the reduction in force agenda and slow down hospitals receiving Medicaid compensation for the care that has already been provided. In general, rural hospitals are struggling right now, laying off staff and cutting service lines, especially labor and delivery units. Family practice, primary care locations are very booked, and many aren't taking new patients, particularly Medicaid patients. This means many patients are losing their existing healthcare providers as clinics and providers merge with larger networks and move to larger cities. Existing patients can't get an appointment with a new provider. Annual physicals, preventative care, and smaller issues aren't being addressed. Our patient census has been consistent, but the patients coming in are requiring more complex care and have longer stays. Well, Joan and I are proud that he finally got an adult job, Joe, because he was a ski patrol for 14 years at Keystone, which is a lot of fun, but you don't make a whole lot of money. Well, our first guest speaker is on video, actually. You want to run that? Unfortunately, with the changing of locations and stuff, we ran into some technical issues. And so this is a great video. I'm just going to set the context for this. During the lobbying on Medicaid in May and June, the vote was in early July. People were going to Washington, D.C. to lobby. And so this lady, Nancy from Iowa, had contacted Senator Joni Ernst's office for 3 months, trying to get an appointment for the day she knew she was going to be there. And they never got back to her. So she made this video of her visit there, and we'll see how it goes with just listening to the sound, and I'll talk about it a little bit more. Can you hear?
No.
No.
Okay, well, what happens is she's there. It shows a picture of her being greeted by Senator Klobuchar. And then she goes to Senator Joni Ernst's office. And while she's there, she's talking to the receptionist, and the receptionist is giving her trouble because she doesn't have an appointment. And she doesn't have an appointment because they wouldn't get back to her. Senator Ernst sees them there. She's a mother with a child with significant disabilities in a wheelchair, etc. Senator Ernst just walks right by. And so to me, it's symbolic of how the Republicans treated the whole Medicaid issue. Oh yeah, we're going to support you in healthcare, and then they screw you. I guess I'm being professional. Oh, I'm retired. I don't have to account for it. But we do have another national speaker, Andrea Dukas from the Center for American Progress has joined us tonight, and she's going to share some thoughts from their organization's point of view.
Believe it or not, I am Andrea Dukas, currently Vice President of Programs at Peterson Center on Healthcare, formerly Vice President of Health Policies for the Center for American Progress, CAP. Those who need Medicaid most, including people with disabilities and the elderly, will be affected by the bill's cuts. The nonpartisan Congressional Budget Office estimated that the big ugly bill will cut federal spending on Medicaid and children's health insurance programs by $1 trillion, due in part to eliminating at least 10.5 million people in the program by 2034. With new federal limits on Medicaid eligibility, likely increasing the number of uninsured, along with other provisions that restrict states' ability to raise revenue to fund their Medicaid programs, states will have to reevaluate their budgets to either supplement the spending or cut services. Research shows that when federal funding for Medicaid decreases, states tend to cut optional benefits, such as home and community-based services, which are those services that help the disabled and elderly to live in their communities outside of institutions. The cuts to Medicaid funding will affect everyone due to hospital closures and the healthcare workforce layoffs. Medicaid paperwork requirements will cause eligible people to lose coverage. While some advocates of the bill have claimed that it will stop the subsidization of competent adults who are just choosing not to work, the reality is that nearly all Medicaid recipients who aren't able to work are already working indeed. Only 8% of recipients between the ages of 19 and 34 in 2023 weren't working due to retirement, inability to find work, or other reasons. Those who were not working were statistically more likely to be older women who left the workforce to care for aging parents or children. Research indicates that paperwork requirements such as those in the bill, particularly for Medicaid, doesn't increase employment rates and often increases overhead costs. A group of researchers evaluated the first year of paperwork reporting requirements in Arkansas and found that there was a significant loss of Medicaid coverage in the initial 6 months among eligible people and no significant change in employment. The bill will put rural hospitals at risk. The bill includes $50 billion in relief funding for rural hospitals over a 5-year period to help reduce the disastrous impact of the bill's roughly 1 million in 1 trillion. Excuse me. So 50 billion, 1 trillion, 1 trillion in Medicaid cuts. As of May 2025, there were approximately 2,086 rural hospitals receiving 12.2 billion a year in their net revenue for Medicaid. Rural hospitals have some of the lowest operating margins in the country, especially compared with urban hospitals, meaning that any reductions in revenue will lead to closures. Notably, children and non-elderly adults are more likely to rely on Medicaid if they live in rural areas compared with urban areas. The prevalence rate of disability is also higher in rural areas, and disabled rural residents are more likely to be Medicaid recipients than disabled urban residents. This leaves disabled people as some of the most at risk. In conclusion, approximately 16 million people could end up uninsured due to the bills, causing massive disruptions in healthcare. Congress is making historic cuts to essential services to give cuts to the wealthy and disabled people and other vulnerable communities who will likely bear the greatest burden.
Well, thank you, Andrea, and thank you for coming from Washington, DC to join us tonight. We also invited John Conley from the Minnesota Department of Human Services, who's in charge of Medicaid there. So I'm representing him tonight. From Minnesota. So first of all, on the Minnesota Department of Human Services website, there's a wealth of information on Medicaid, and that's where most of the handouts came that you have tonight. And those are just resource documents. If you want more, you can go to their website, just Google Minnesota Department of Human Services Medicaid, and you'll find out all sorts of sources there. So reducing Medicaid coverage will make Minnesota sicker. Losing Medicaid is associated with an increased rate of death among infants, children, and adults. For example, one study found that suicide, fatal alcohol poisoning, and overdoses increased significantly after cuts to Medicaid. In addition, individuals with healthcare coverage experience more cost-related delays in assessing care for prevention or treatment, delayed or missed medications, and unmet needs for substance use or mental health treatment. Conversely, individuals with Medicaid coverage were more likely to report that they have a usual source of care, that health is good and very good or excellent. John made several points here. Reducing Medicaid coverage will make Minnesota citizens poor, because if you don't have health care, it's hard to work, and you're at risk of getting sick, and he goes on with several other things, and it increases evictions, and Medicare reduces bankruptcy, or Medicaid reduces bankruptcy. Currently, Minnesota has higher average credit scores, lower medical debt, and a lower rate of bankruptcy compared to other states. Reducing Medicaid coverage would take away these important protections. Reducing Medicaid coverage will make Minnesota poor. Several studies have shown that Medicaid grows workforce participation among enrollees due to better managed health conditions. Imagine how that works. Reducing Medicaid coverage will harm our healthcare system. Other states have seen Medicaid expansion has increased the financial performance of hospitals, especially in rural areas, and prevented the closure of hospitals, as hospitals in rural areas are both important community resources and top employers in Minnesota. Closures are particularly impactful. You close a nursing home in a small town, and you have half the labor force without jobs. Reducing Medicaid coverage will harm Minnesota in the future. In addition to harming our residents, our state budget and other healthcare infrastructure, now many of these changes will continue to hurt Minnesota in the future. Specifically, Medicaid reductions would limit Minnesota's ability to respond to changes in our population, including our growing and aging population and emerging health needs of our people, including during any public health emergencies like COVID or measles outbreak. So I want to thank John for coming tonight and all the way from St. Paul. Getting ready to wrap up here pretty quickly. So be thinking of questions that you want to ask. And those people that ask questions will get a free beer. You guys are buying it now. Wine for beer, yes. A little known fact is that our schools benefit from Medicaid services. Wright County Public Schools provide speech, occupational, and physical therapy, as well as other specialized services, including durable medical assistance for students. That includes wheelchairs and those types of things. Students with autism and cognitive development delays paid for by Medicaid. Efforts like this gives kids the opportunity to develop their full potential of becoming contributing citizens. How many of you knew that schools could build Medicaid? No. Yeah, the professionals in that field. You guys all got it. Pardon?
Everybody knows that.
Oh, okay, absolutely.
Yeah.
Prior to the federal budget being passed, 16 Republicans from Minnesota State Legislature, including Representative Joe McDonald of Wright County and Senator Jim Abler of Anoka County, wrote the president and our congressional delegation about this issue. Here is what they said. They wrote this letter in January. It was a pretty good letter. As Republican leaders in Minnesota, we have been partners for designing a state health and human service system that meets the needs of our great state. Medicaid includes services and care for seniors, not just for the poor. And additionally, 50% of all Medicaid enrollees are children. Given some of the large numbers coming out of Washington, we are concerned that there is no practical way to accommodate some of the proposed massive reductions and still provide the kind of care these vulnerable people require. Guess what response they got?
Friggin'.
So they're treated the same way we are.
That was a good letter.
Yeah. Unfortunately, all four of our federal Republican delegation, including Congressman Emmer, voted for substantial cuts to our health care and community service for our most vulnerable citizens, ignoring the plea of constituents in our state legislature. You might not be surprised, but I was on YouTube the other day and there was an ad from Congressman Emmer saying that he is in support of health care for everyone. And
But he votes differently, right?
in Wright County, there are 17,920 citizens receiving services funded by Medicaid. This includes 730 elderly citizens in nursing homes, or 50% of the nursing home population, and over 2,000 people with disabilities and thousands of children. Medicaid insures 592,000 children, or 41% of the state children, in addition to 20% of all mental health services in Minnesota are paid for by Medicaid. Now we are open to questions, but first, I'd like to take a question from one of our national people that's been listening in.
So I've been monitoring the emailed in questions, and so I'd like to share them so that Stevo can respond. Our first question is from someone with the initials DGT from Washington, DC. Even though my big, beautiful healthcare plan is coming out in 2 weeks, just like I promised 8 years ago, I'm failing to understand what the stupid Democrats are asking for during the shutdown. Could you please explain this to me in a way that I will understand it? Aren't they just trying to provide healthcare to, illegal aliens?
So, Donald, number one, DJT, first of all, illegal aliens cannot receive health care. So if the Speaker of the House says illegal aliens, Congressman Emmer says we're trying to get illegal aliens, it is BS. That's not true. They know it's not true and they're still saying it. but we're trying to get, there was Medicaid expansion, which means that at the beginning of COVID, states got extra money for Medicaid to keep people on insurance. And those subsidies expire this year and they have to be renewed. And this is why my favorite Congresswoman, Marjorie Taylor Greene, is concerned because the premiums for her adult children are doubling in size. And that's true for everyone. And the Republicans want to wait until January 1st to settle this, but in the meantime, people are going to have to pay those bills in order to get health insurance. So anyways, that's why the Democrats have to hold tight, because they're not going to be able to negotiate anything once the shutdown is over. Is there anyone on Zoom that has a question? Anyone in the audience have a question? And you have to say what news source you're coming from. So you can say Fox News, Newsmax, NPR, whatever. And I'll repeat questions.
Yeah.
I'm interested specifically. I'm interested specifically in the impact that this is having on the alternatives to Medicare that seniors use. That are private. I won't call them all the things I'm thinking of.
Okay.
But I heard or I saw something that made it look like at least one of the Minnesota alternatives to Medicare plans is actually closing its doors for next year. Is that accurate?
Yes, that's accurate. And I don't know if that has anything to do with what's currently going on, but it has to do whether they're making profits or not. And if they don't make profits, they're not going to provide it. So that is a big issue for seniors, because you might have to change who's providing it.
Steve, what's the total, what's the percentage reduction that would be affected by theirs, what's currently proposed? What's the percentage of our,
I can't tell you that right now.
I mean, is it like 5%, 10%?
It's going to be taking place over a long period of time, because simply in regards to the workforce issue, they're not concerned about people working. What this does is it puts more paperwork requirements, which are very difficult for people to comply with, getting your paycheck stubs and getting someone to sign off on your volunteer work. You don't have transportation, you're supposed to be getting all this. Instead of doing it once a year, they do it. And even if you're a person, say, with Down syndrome, which isn't going to change, you still have to go in once a year to get eligibility. Now it's twice a year. So they're just counting on people dropping off because they can't comply with the Medicaid. So it's a very evil plan. Cynical.
We need to have you use a microphone for the recording for the people that are on the Zoom.
Yeah.
Okay. Don't you have a...
Well, I do have a question here. You actually answered one of them from our dear friend Marjorie Taylor Greene. But she did have in addition to her question. So she does ask, why are my adult son's medical premiums doubling in the next year? Does it have something to do with Jewish space lasers?
The answer is yes.
And then there's a question from Amy Kay in Washington, D.C., and she wants to know, how will states and school districts get special ed funding with all but a few of special ed staff being laid off?
I was going to mention that. On Friday, they laid off all the special education staff. And Joan's going to take just a minute to tell you what those staff did and how it's going to impact Minnesota directly and all the others.
So in my previous life, I worked at the Minnesota Department of Education, supervising in the special ed division, particularly for programs for students with significant disabilities. I collaborated closely with my colleagues at the U.S. Department of Education. One of the grants that I oversaw, wrote every 5 years and oversaw the outcomes for, were for students who are deafblind, having comorbidity vision and hearing loss. Every state in the union had a deafblind grant based on the percentage of children who have deaf blindness, which is 0.01% of all children receiving special ed services in the state, right? So we're not talking about a lot of kids, talking about less than 150 students in the state of Minnesota. Multiple states, and the rumor is now that every state will be losing their deafblind grant. The state of Wisconsin lost their deafblind grant because they included 2 words in their grant application. One was privilege, because a mother said, it is a privilege to work with this program and receive the services for my child. The second word was transition. Oh. Now you realize, of course, under federal law, we are required to support students transitioning from K-12 education into post-secondary life. But we're not allowed to say that anymore, even though federal law requires us to talk about it. So grants are disappearing, supports for our most involved students are disappearing. There are states in this union, Minnesota, by the way, does a pretty darn good job in providing special ed services across the state. Every year, the U.S. Department of Education has done what they call, they evaluate every state's performance. The highest standard you can reach is that you meet requirements, okay? Minnesota has met requirements for the past, I believe, 12 years. That's the best you can do. There are many states, for example, Texas comes to mind. Can't imagine why. That requires significant oversight by the U.S. Department of Education to ensure that the civil rights and the disability rights and every other kind of right for kids with disabilities are met. There is no longer anyone at the U.S. Department of Education who can provide that oversight. I suspect I shouldn't go into this as passionately as I want to, because we're not talking special ed. But maybe that would be a different topic some other time. But we do have to be very, very aware of the fact that the special ed rights of our students with IEPs, individual education plans, students with 504 plans. In many cases, not in Minnesota, but in many states, students who are gifted and talented are served under the IDEA, the Individuals with Disabilities in Education Act. So we are seeing students across the country being denied their civil rights. And we see oversight of states being denied. It's going to be bad. It's going to be really, really bad.
Stevo, I do have a question for online.
Yes.
Can you, it's lengthy, so can you? There we go, great. The question comes from Ann Jones in Minneapolis. What is a good way to educate Minnesotans that Medicaid and Medicare provide something like 44% of funding for healthcare facilities, hospitals, clinics, etc., probably more for nursing homes? When these essential healthcare facilities fail, they fail for everyone, not just people on Medicaid. So the question is what's a good way to educate Minnesotans about Medicaid and Medicare?
I just read a great book by Maria Tessa in the Philippines. She won a Nobel Peace Prize not too long ago. And believe it or not, people get most of their information now off the internet. And so if we're going to educate, we have to be on the internet. Frankly, I'm not on the internet. But those of you that are have to take some of this information and share it. Because that's the way to go. And there's so much misinformation out there that you have to counter it. And it's not easy. It's actually one of the big reasons that we're battling for democracy right now is the false information on the internet. On a more local basis, I wrote an article for the paper last spring. I should probably write another one on Medicaid and include some of this information that I shared tonight. Letters to the editor. Those sorts of things. Anytime we can talk about it. But I would say the internet is the key one. if we're gonna have any impact, especially on younger people. And we have to figure out, as a community of middle-aged people,
Thank you.
how are we going to share this information with the younger population that's on different, I'm blanking on the term, platforms, and where they're getting constant information that's false. So it's a real challenge as a society. Thank you for that question. Any other questions? Okay.
Any of you have grandchildren that are old enough to get on Instagram, etc., that you could say, hey, keep it simple. We're not gonna read a whole lengthy page. Can you get a couple facts together? Can you send it to your grandkids? Can you talk about it? And can you ask them to share it? Seriously, that's what it's going to take. We do have a young gentleman, Rob Pettit, who is looking at trying to get on, he's on a lot of platforms and trying to figure out how to get some of our information off of our Facebook page and our website to send out. It's one person. He said, once he gets it going, things will go out. He's gonna need information, but we don't have to wait for this great volunteer to load off my shoulders to do that. You've got to find people. I'm now on Instagram. I have no idea how to use it, but I'm on it. I'll figure it out because people have friended me and I'm going, oh, I wonder what that means. You can ask them to help you. It may not be perfect, but if we don't reach the younger population, people, we are really in trouble. On that happy note.
There you go.
Thank you, Sue. Any other questions? Are we done with the question?
Question about that, but
Wait.
oh.
I was just looking for a sign up sheet for the letters to the editor. So
Somewhere over there. Where? I think both says.
okay, I better get on it.
Yeah, all of this, like,
All the table.
Very best.
I'm wondering about the special education programs for our students in Minnesota. We are not going to just say, oh, okay, we can't service you anymore. We are going to service those students because we have a good educational program. So that's going to impact Minnesota's budget because we're gonna have to pick up those expenses. So that's something that we haven't talked about yet. The impact of these changes on Minnesota's budget.
absolutely, money's gotta come from somewhere.
Watch your beer bottle there. It's over the top of the table. Okay, so this is a question on Medicaid and the cuts to special ed, but also the overall economy. So if we're losing all the para professionals in our schools, the burden then becomes the teachers have to pick up the slack. If we have such a shortage of teachers, how are we gonna support these teachers?
Close the public schools.
I think that's the goal. Is that the goal I'm asking?
One of the first cuts that came from the US Department of Education was teacher preparation programs. In Minnesota, we had some fantastic programs in place. I worked with Mary Beth with that on those kind of projects back when we were both very young. Funding cuts we had an incredible program of paraprofessionals to teacher licensure that was innovative across the country. Guess what the first thing that was cut was? Teacher shortage in Minnesota is drastic in the areas of special education, math, and science. That is happening also across the rest of the country. Teachers of the blind, visually impaired are the most drastic most drastic shortages in the country. There are roughly 20 programs across the country that prepare TBIs, teaching blind, visually impaired, and funds are being cut. So yes, Project 2025 clearly called for the destruction of public education. These are all steps, in my opinion, towards the destruction of public education in this country.
And I really think that in a rural community, I think in rural communities, that's gonna be really difficult, because when I drive into suburbs, like Maple Grove or even St. Cloud, there are so many new private schools being built. You don't see that in rural areas. You get one school in the rural area, and if they're unfunded, you have kids that won't be educated.
So obviously, we know that. Just a second. We know that in public education, we are required to serve all kids. Private schools are not required to serve all kids. We know that when we start subsidizing private schools, the public schools will remain with the most challenging students to serve, or the parents who do not realize the options that they have. So.
And vouchers don't fix that.
Vouchers will not fix that.
So I wonder if a lot of these efforts by the current administration to cut this kind of medical funding is a way to make us, the US citizens, more vulnerable. So then we are easier to control. You think that's true, and have power over us?
Absolutely.
I think Chuck said that very well. And I just wanted to say, as far as preparing for this presentation, it was pretty easy. Every morning I get up and I read my newspaper and the news links, and I just saved about 50 articles on Medicaid.
Yeah.
So there's a lot of information out there, and obviously Joan's an expert on education, but one thing they haven't said is that the money going to just regular ed or to the school districts is also being cut in various grants and that type of thing. So this is really going to impact the schools, and that way, and that in turn, as Wendy said, will impact the state budget.
I just want to point out that Minnesota has a unique funding per pupil funding formula. That it has a baseline dollar amount that every child gets, but then there's other ways that money is built into schools based on need of the district. And this formula pits city schools that might have more complicated needs with every other school district in the state. Because other districts feel slighted, and districts in areas like this actually are amongst the lowest for pupil funding. Because we have some agricultural land we're still getting dollars off of, but also because in towns like Buffalo and Monticello, the average income is just not that low. So the one thing we can do while we're fighting off these federal assaults is really focus in on making sure our state is doing everything it can in using every dollar wisely, and making sure we still have a Democratic governor who is ready, willing, and able to make sure our schools are strong systems. And the thing that will happen if we keep our schools strong and the country falls to chaos is that we'll have an influx of people who want to live in Minnesota. That's coming because of climate change anyway. That's coming. And so for Minnesota to be prepared to have strong schools and an influx of people that have decided being green and having water are good things, we really have to put the Fair Consortium back together, amongst other things. I said on that. And we have to keep paying attention to what is happening on the state level, because we can control that.
Thank you for being on the Fair Consortium. It's a good project.
It was a good project. I saw it fall apart, even at the end.
So, and for, I'm sure most of you know this, but 50% of the students right now are students of color. And, you know, so we're already changing drastically and we need to make sure those kids are educated if we're gonna get our social security paid and our Medicare paid. So you guys get out there and work hard on this. I think if there's no more questions, we'll wrap this up. And it was very enjoyable talking to everyone tonight. And thanks for those great questions. And we'll turn it over to Sue.
Okay.
All your gifts, no, you're right on the table.
And going in circuses, but I'm.
Making a difficult topic, somehow entertaining.
He has a great sense of humor.
Let's hear one more time for Stevo.
Unless are there other questions or concerns or even topics that maybe you would like us to bring up at some point? Rose?
Do you want to say something about the press release and the letter to Emmett?
No, I'm gonna let you, because that was complicated.
Here is the sign up sheet. Those are for the letters to the editor for, what's his name? I'll just, so are we getting a copy? You're sending out a copy of the. I'll email it to you, yeah. Okay, so I just wanted to let you know that we just quickly today drafted a press release that says that we want a public apology and we want Emmett to retract his statement about people who go to and organize milking protests that were terrorists. And so we're also sending him a private letter by email and also a certified letter demanding him to do the same. And then we're looking for the CD6 indivisible groups to sign on with us. And we've got 4 of them so far. I think there's a couple that we're waiting for a response from. But we want to get it out as soon as possible, so probably tomorrow morning. So once we get it out, we'll send it around to people too. So watch for that. We assume he's not going to respond, but then we're going to try and get more people to support us and do a press conference. Get an ACLU in there. I've got a couple of former senators who think it's unconscionable. It is unconscionable. He put a big target on our backs, so it's really wrong. He's evil. Yeah.
No, and I guess I'm gonna contact his office tomorrow because when Charlie Kirk was murdered, they said everyone had to tone down the rhetoric.
Yeah.
And he is clearly not doing it.
And that's mentioned in the press release, because he said that with Amy Klobuchar, they were gonna tone down the rhetoric after Hartman was killed. So we name him as a hypocrite for that as well. So it's a really hard hitting press release. Yeah.
So I have a suggestion. I wanted to make it easy for Congressman Emma. So I called up and said, I'm a member of Antifa. And listen, I think we should all be members of Antifa. During World War II in Denmark, they told the Jewish population they had to put on a yellow star or whatever color it was. And the next day, the king came out and had a yellow star, and so did most of the other citizens after that. So we're all members of Antifa.
Yes, we are.
Other comments or thoughts? Okay, read the blast, so we things updates. You are welcome to stay here and order another whatever you want if you'd like to. It was really nice of you to come this far for those of you that had to travel, and for those of you that didn't have to travel this far, I'm glad you showed up too. So take some time to visit with people if you want, order another whatever, and thank you very much for coming.
Thanks.